Hello, good evening. Welcome to AfrinityTV. My name is Ami and I'm going to be your host for this evening. We have an amazing event happening on Saturday the 29th, and it is the Health and Social Care Network for providers. And today we're going to be speaking to some of the key speakers. We've got the founder, and we also have the MC for this evening. So it's going to be in a very exciting time. Welcome on stage, Mr. Godfrey. How are you this evening? Hello, Denai. Hello, Mr. Masaka. Welcome.
Hello,
Thank you,
everyone.
thank you.
Wow, there is a phenomenal event happening this Saturday for healthcare providers. I'm going to start with you, Mr. Godfrey, as the founder. Tell us a little bit about the event. What's the inspiration behind it?
Thank you very much, Biami. The Health and Social Care Providers Network was formed some 3-4 years ago in response to the needs of minority holders of care companies and those who wanted to set up, but they found it very difficult to organize, to have support, and to be able to talk to people. So, having worked in the industry myself for the past 20 or so years, I've managed care homes, nursing homes, residential homes, children's homes. But the most difficult part is, every time I was managing, 90% of the workers are Black to minority people. And the top 3% is the white British owned organizations. We provide 90% of the workforce to keep a 3% of the population in management and leadership and ownership. So we said we want to change the narrative. We can't continue just being workers and workers. So we went on a drive to invite people to come into the UK health industry, where the budget at the moment is around 33 billion pounds per year within the healthcare industry. We were just taking the droplets really of what the industry was offering. So that was the inspiration behind forming the Health and Social Care Providers Network, specifically targeting people who do not have access to information, resources, and knowledge to set up healthcare businesses.
Wow, really powerful. Thank you so much for that. Just seeing the need and seeing the gap and just seeing the differences. And it's such a big area in the UK. We see a lot of people coming into the UK and wanting to access this particular field, and being able to have a platform that you've created is absolutely phenomenal, because it's not just about doing the work, but actually it's the network aspect that's really important. What's been some of the trends or some of the message that you've seen as you've kind of built on this platform? Because this is the 14th edition that's happening on Saturday, so that's quite a journey. What's been the constant message or the consistent message?
The consistent message, Biami, is that there is an affinity, just like your TV network name. There is an affinity for knowledge out there. People want information, and within the healthcare sector, that information doesn't come easy. It's in the public domain, the information, but it's not presented in a discernible manner where you can easily get the information. If you go onto the Ofsted or CQC, Care Quality Commission website, it's like you are in a maze. You don't even know where to go because of the complexity, but all the information is there. So we are here over the past 13 episodes or sessions, we call them. Our drive is to include and empower our people so that they have knowledge. Yes.
Thank you. As they say, knowledge is power, and
Yes.
the information is out there, but sometimes it's how do I access the information and where do I go to? And would you say, with knowing that industry and the sector can be quite gated, and what impact does it have?
I mean,
Yeah, go for it.
Sorry, yes.
Yeah, no, I was just going to add, and what impact does it have? Does it create any limitations, or yeah, what kind of impact does it have?
Yeah, the impact which it has had is that the Health and Social Care Providers Network, just for your information, we are a group, or we have got two groups where we have paid up members and non-paid up members. So we have got at the moment a Telegram group with close to 2,000 members, and then we've got 5 WhatsApp groups which are all full. So in total, we are supporting up to around 10,000 providers and potentially people who are interested within the healthcare sector. As you know, WhatsApp has got a limit of 1,025. So every time a group is full, we create another one, we create another. So we are on our 5th group now, and
Wow.
Telegram as well. So it's about the expansion. The appetite is out there, and
Yeah.
we are saying to the thousands of people who are there, let's come and reason together. Let's come, we share the resources, the knowledge together, because we've got people with vast experience who, when we come together, we make a big impact.
Yeah, no, absolutely. It sounds like you are making an impact. That's huge what you're doing already. And so when you do hold events, like this, that will be happening on the 29th on Saturday, what should people be expecting when they come to this type of event?
Yeah, I will leave Danai to talk about some of those things because she's a specialist in that. But from my perspective, I'm going to be one of the presenters. I'm going to be talking about, because healthcare is highly regulated in England and Wales, or in UK in general. So what drives healthcare is effective policy management and implementation. So that's going to be my topic, how we can use our own policies which we create in order to effectively remain compliant, because 3/4 of our job is not about creating the company, it's about maintaining the company. When they are created, people are not compliant. So we are going to be talking about that. But then there is a champion in training in the name of Gwyn. He's here, he's going to talk about himself. So we are going to be having accountants, we are going to be having immigration lawyers who are going to be talking about a lot of things. The COS scandals happened. The government has changed the regulation about international workers. We are going to be having people talking topics which in some of the African communities might not really be comfortable with. So one of our crowd pulling topic, we are going to be talking about menopause and how it affects us within the healthcare sector and within families. So we are going to be talking about where to find resources. If you are looking for money, you are looking for bridging funds to fund your businesses. We are also going to be having we have had sponsors from international money transfers, because the diaspora community, I don't know about other areas, but in Africa, we account about 40% of the GDP in Africa comes from the diaspora. So we work with all companies where we are remitting money to Africa. That's why we are, most of us, here to support our own families back home. So the platform is going to be a plethora of ideas. There are going to be exhibitions. There are going to be training companies, infection control companies, complex companies, healthcare, children homes. So all those are opportunities for the 14th time for us to be. We don't repeat the same subject and content every event, and the appetite is so high. So we request and advise those who haven't booked yet. Unfortunately, we have got limits to the hotels. We have had instances when we were in Manchester, when we were in Liverpool, and when we were in Newcastle, we had to send people back because the hotel was full.
Wow, that's a testament on, like you mentioned, about the appetite, and also it's quite interesting. You speaking about just the compliance aspect, and just making sure that you're not just setting up a company, but actually you're maintaining compliance. Dana, I'm just going to come over to you for a second. This type of event, I'm looking at it from a networking perspective. There's a plethora of information that is provided to people attending, which I'm hearing how important and how critical it is. how important would you kind of define that importance of networking and connecting with others? Because I can imagine there's going to be so many different type of people that will attend.
It is very important. As previously mentioned, this will be our 14th session. So one of the grounding ideas behind this whole movement is we need to cultivate a culture where we're each other's keepers. So we've had people whose ideas birthed an actual company just from an idea of thinking, okay, so I might want to do this. But because they were able to come and network with us and partner with people, we linked them with people who were in the same boat, in the same shoes, that have had to navigate some of those spaces to where they've now navigated and now actually operating businesses. And we have all these testimonies from people we've helped from concepts to fruition. So we don't just pride ourselves in the vision, we pride ourselves in actual testament and results of what the network actually does. My background also is I am a registered manager to a domiciliary setting. So while I may have hosting and planning these events, my passion is also within the health sector, to where I will be the first one to offer my phone number to anyone who has questions on how to navigate the space. Like Godfrey said, it's 33 billion pounds. So there is no point in me gatekeeping information that could potentially help somebody else.
Yeah.
And one of our founding visionary concepts is we need to be able to help each other navigate the space to where we are never labeled just another Black owned business. We operate in excellence. So the idea is people understanding the importance of networking, not only as a resource, but also as a way of living, because a lot of the bigger companies, they've gatekept a lot of this information to where it has been almost impossible for younger companies and younger entrepreneurs to penetrate. But because we are creating spaces and networks like ourselves, we have seen a shift in the marketing in the markets, where we are starting to make an impact, where these small medium enterprises and small medium providers are making a difference to the broader picture. So it's very important that we understand the importance of networking, and there's nothing better than us starting with ourselves and making sure that we understand by ourselves, and then we can support one another, just grow from there.
Yeah, no, absolutely. Thank you for sharing that, because I was going to also ask, a little bit about kind of your background and your journey and how that ties in to the passion that I can clearly see. Um, tell us a little bit about kind of the ethos and the value, because you speak about the excellence, and I've heard from Mr. Mishandu, that just maintaining that kind of compliance. And that tells me that, there's a specific type of way you need to ensure that you operate in, and then changing the narrative. It's not just about being a Black person, another Black business, or that's the only route, because there could be some negative thoughts or narration around the care system. What's the key values that really holds up this networking?
The value is basically just instilling in anyone who's a member, or anyone who's thinking of becoming a member, the importance of operating to excellence. And unfortunately, we almost have to be twice as good to be recognized just half as much as our white counterparts, or anyone else in the industry. So the value behind this network, this organization, is we need to rise above the stereotype of another Black owned business, because automatically, unfortunately, we live in a world where it's then automatically assumed that it is a Black-owned business. Then that means we're not compliant, we're not following regulations, we don't operate in excellence. So what we are trying to change is we're trying to change that narrative that even the Black-owned businesses can operate just as well, just as good, just as compliant, and follow regulations to the T. And we have seen instances where we have banded together as a group and we've made changes that have benefited quite a few of us. So one that comes to mind is a few Black-owned and small to medium providers were having issues obtaining packages once, even though they had tendered on a particular platform and with the local authority, but there was just no traction for them to get the business. So as Health and Social Care Providers Network, we banded together, we approached the commissioners, the local authorities to present our case. And lo and behold, it changed the whole landscape to where these businesses were now able to get the packages. And now they're one of the first businesses that particular local authority calls when there is a need and there's a shortage. So the idea is there is power behind unity of us as small to medium Black-owned small enterprises versus trying to fight by yourself to try and be recognized, when it makes a huge difference when you come together as a united front. So at the core of our network is unifying the small to medium Black-owned businesses.
Wow, amazing. Thank you so much. Mr. Mashanda, I'm just going to come over to you. With the Health and Social Care Providers Network, you've got a variety of speakers. As you mentioned, you're touching on so many different subjects, which is really great. Things like menopause, how that can impact a worker, or just in terms of how they operate. And you mentioned that every edition you have different conversations and speakers. How do you go about finding the right speakers for the specific edition? And what's the idea behind finding the right people and topics?
Okay, so for us to find the right people and topics, we actually do not look for the speakers because we are a membership driven. So our members don't only attend the Health and Social Care Providers Network events, they go to other events. And when they go to other events, like for instance, we are having Gwyn Masaka, he is now part of us, but for 8 to 9 sessions, he was not there. But word came to us when people went to events where he was a presenter, and people would come and say, you know what, I think if we have such a person within the Health and Social Care Providers Network, can you approach? We don't know how to approach. We've got his number. We want you to invite them to our next event. That is how we have grown externally, people being recommended for their experience and good deed within the industry. And that's how we get members, really. Then we have got also sponsors. This event, this is a non-profit making organization. We do not intend to make money out of it. So we have a lot of people who sponsor these events. So some of the sponsors, because they have got, as I have said, we've got reach of up to 10,000 people. Where in this planet will you find 10,000 people brought together for you without doing anything?
Yeah.
Market your products and services. So sponsors approach us, and we also give them the opportunity to market their services.
Wow. And I guess that's the power of networking, isn't it? And they say your network is your net worth, and it's not about you're going out and just getting what you can, but maintaining those relationships over time. What's the one thing that you are most excited about, or that you just really can't wait for for Saturday and really want to see? What's that thing that we need to know about?
No, the most important thing for us, like I'm saying, we've done it for 13 times.
Mhm.
It would be so boring to invite the people who were on session 1 and they are still the same people coming to session 14. That's why we are a unique organization. Most organizations are in UK, they are regional based. If they are in London, they do all their events in London. Our concept is we bring the event to you. So we have been to 13 different places throughout. And Birmingham, as you know, it's a metropolitan mixture of culture, Black, Asian, Chinese, and other. So the excitement is about to meet new providers, new people with new potential, because someone in Leeds might not be able to come to Birmingham, someone in London. But so we are regional focused. Every 3 months when we go into the new area. And this time we have been honored to have our guest speaker as the mayor of Birmingham. It's not easy to pull these people for an event.
Yeah. No,
So we give thanks to Danai and company and team who have managed to do that. And we still have to work with Care Quality, CQC, and Ofsted, Skills for Care, Health and Safety Executives, where these are government regulators whom we will be inviting to come and speak. And we are saying to people, come and let's reason together. So I'm excited. My excitement is meeting new people.
Amazing. Fantastic. And I guess from yourself, before I go back to Danai, where do you see HSCPN going? What's the future? What's the next thing?
HSPCN, as it is a membership driven, we are an agile organization where we change according to the needs. What we used to do, because remember, we used to operate even during COVID time. But by then we were just remotely meeting on Teams, Zoom, Google Meet, and the like. But so when we came out of COVID, we had to change the narrative to suit the needs of our members. So where we go is driven by our members. But at the moment, there was a phase where there was so much demand to register organizations. So in our own books, in our own regulated, we have over 700 paid up members who are pushing. But our vision, we are seeing, we have so many, like what Dana has said, we have so many companies which have registered who are failing to find customers. But when you listen to the news, all the hospital beds right now, they are blocked because they are saying there are no providers out there to look after the people who are treated in hospital. They've recovered, they are good to go home. And the government is saying there are no companies who can support these people at home. So our future now is to engage the companies, the government, local authorities, to say, we have the members, we have the staff, we have the companies, so give us the opportunity. So that's the future. We don't just want to be numbers. We want to be numbers and contribute to the crisis, which is a national crisis, which, if I can just add, is going to be made worse with the immigration changes. We are already seeing the impact right now. Ourselves, besides being the health and social care providers network, I run my own dom care company. We can't expand because we don't have staff. There are so many clients out there in where we work, but we can't take the packages. We can't take the clients. Local people look down upon healthcare work. So we are in a very tight situation where there are clients in one side, but we can't support because the route which has been helping the government for the past 3 years has been closed. But the effect of that closure, we are beginning to see it now.
No, absolutely. And
Can I just add to what Godfrey was saying? So one of the most obvious changes to the immigration rules surrounding the sponsored workers is, as an employer, for you to recruit somebody who is on a sponsored visa, I have to pay them a higher wage than the local person. So what local person would want to work for a lower wage than somebody who has recently come into the country? So that in itself has created this disparity in terms of the people willing to work and the people wanting to work. And then there's also going to be the mass exodus of everybody who came on the sponsored visa, that once they get the settlement, they are not going to remain in the same line of work, because the opportunities, they're just limitless. So these changes are affecting real people on the ground, because the changes have a knock-on effect to where even the budget now is starting to affect the way people are looked after.
Yeah.
So, one of the things that we're also trying to do is we're trying to empower people and help them navigate these new spaces with these new changes that are coming into play.
Yeah, no, absolutely. It seems like we're really getting into the criticality of why this matters even more. And we've got about 4 minutes to go. So I'm gonna quickly come to you, and Dana. And I think, because I remember Mr. Godfrey, you were saying, one of the speakers, there's going to be lawyers speaking, etc. So I mean, seems like this is so essential, and actually it's the right time with all of the changes that's happening. This is the perfect timing to attend this event. So Danai, tell us about the preparation, and how can the admission, how can people just really get in there before the doors close, and find their seat in there, because it's really important.
To be honest, I really hate it when we have to tell people that we're sold out, because it's one of those things that sometimes, because of the limitations that are placed on us by the spaces that we find, we have to turn people away. So like Godfrey mentioned, we are a traveling conference. We travel from region to region, and Birmingham is the first city that we've held the conference twice. Birmingham was actually where we had our inaugural event when we started some 3 years ago. So, and it's coinciding with our yearly Christmas gala. So it's also an opportunity for providers to bring their staff to, just let their hair down a little bit and enjoy as the Christmas season is starting. So this year we're going to be hosting it at the Leonardo Hotel in Birmingham. Tickets are £110. You can find all tickets and ticket listing information on www.hspcn.org, or I'm sure you'll have all the information on the link, their phone numbers to call to find out if we have spaces. And if I'm not mistaken, we have less than 30 spaces left. So over the next few days, that's when people start, buying last minute tickets.
Yes.
And it is very important, because it's not just about the the health sector. It's about everything else that encompasses being able to run a business. So we're talking insurances. We even talk about our social responsibility as company owners and as company providers, so that it makes a more of an impact to everyday life, not just something that people can just tick, just have a tick box exercise to say I attended a conference. So yes, on top of that, we also have raffle prizes to make it a bit more fun. We've got amazing prizes that some have been donated by our partners and our sponsors. So it is going to be a joyous occasion. We're just trying to learn as much as we can, be compliant as much as we can, also trying to remember that it's Christmas. So yes, so we have the conference starting registration opens at 9 a.m. The conference starts at 10 until about 6, and then from 7 p.m. onwards, we have the Christmas gala. So where you bring out, you bring out your best clothes. It's a black tie event, so we like to, we like to impress on people to dress to the nines, so that they can just have a wonderful time.
Wow, fantastic, amazing. I did want to get last kind of few words. I think we are about closing. This has been a really, really amazing, and I actually feel honored to be part of it, because we've touched on so many things, and this is a conversation that needs to be had. And if we've got so much to say, I can imagine, the need from the workers and also the community, like you touched on, Mr. Mashandu. Hello, Mr. Masaka. We're just about to conclude. You're very welcome. I know that you are, one of the special speakers. So they have a lot to look forward to. So thank you so much for coming to this session. This is Afrinity Online TV. I'm your host, B. Ami. One last thing, where can they find you? If you just want to just quickly go around in case they want to reach out, if we could just take a minute to do that. Website, social media.
We're available on Health and Social Care Providers Network. If you just search Health and Social Care Providers Network, all our contact information is there. We're available on WhatsApp. All the WhatsApp numbers are on there as well. We have an amazing team of people. And if you reach out, you'll be directed to the right person. And I promise you, if we do not have the information, our team always goes above and beyond to make sure that we get the right information to you.
Perfect. Thank you so much, Danai. Mr. Masaka, I know you've got a really key role on Saturday. I'm sure you've got very impactful information to share. Can you just in 2 minutes or so give us a little bit of a taster, bit of a teaser on what to expect on the topic that you're going to be sharing?
Oh, thank you ever so much. I'm so sorry my technology was betraying me just a few moments ago, and I was battling with it. In terms of what I'm going to share this weekend, I'll be talking about how to retain your staff and have competitive advantage over your competitors in terms of having a workforce that is really sharpened, and sometimes even helping you and your team to deal with what matters most, which is frontline work, instead of dealing with toxic issues about colleagues not getting along, service users complaining about the quality of service that is being provided, managers having to wreck their heads as to who to send to where and when, and things like that. So I will be talking about training so that your team may have competitive advantage, because many people underestimate the value of training, even for managers, even for the frontline staff, even for everyone who is in your team, including the office staff. And as adults, many people think that adults are not very keen learners, but it's actually the opposite. Children are believed to learn faster than adults, but that's not true. Adults learn much more faster than children because we have the experience. We have been learning all our lives. So all that experience, if channeled properly, we will have a team that will just work like clockwork in everything that we do. And guess what? We'll have, at the end of the day, satisfied customers, satisfied employees, satisfied stakeholders. And I do believe this only comes about if we really consider and invest in proper training, and we make it central in all that we do.
Thank you so much, Mr. Masaka. You're absolutely right that training it's it creates sustainability, isn't it, which is really important, and it just kind of touches on what's been said. And links everything together. So thank you so much for touching on that. So thank you so much, viewers. Thank you so much to our guest this evening. Affinity TV will be covering the event. So stay connected on all social media platforms, Affinity TV network. And I will be seeing you all. And I'm very excited and I cannot wait. So see you all on Saturday. Thank you so much.
Thank you.
Thank you.
Thank you.
Yeah,
Can't wait to be there. Bye-bye.